We will go ahead and get started. Welcome. I am Allison Schwedner. I am the director of the collaborative. Christina is our coordinator. So Christina, thank you for all the work you put into the meeting today. For those of you that are new to our collaborative, or if it's your first time at one of our resource sharing meetings, our collaborative is comprised of about 47 nonprofit and government organizations in the Tahoe Truckee area that really work together to address the fundamental needs of kids and families and seniors in the North Tahoe Truckee area. So we do a number of different things, but one of our primary roles is to convene our partners. And what we've heard from many of you is that kind of like our highest and best use as a collaborative during the pandemic and during these times of rapidly changing information is to really provide you all with real-time, up-to-date information about things happening in our community, and then also allow you all time to connect with each other and build relationships and connections and coordinate services and talk about things that really matter to our collaborative and to you all during this pandemic. So we have structured our meeting today and our meetings over the last several months around those two areas. So we're going to provide some critical updates to you all in the areas of education, kind of housing, vaccinations, what's happening with COVID. And then we're actually going to spend some time in some small groups in the structured conversation called Living Room Conversation. So I'll talk more about that when we get later on in the meeting. And so for sake of introductions, if you could just go ahead and put your name and your organization in the chat box, just so we know who is on the call today. I know there's quite a few of us, and it's hard to see because there are again quite a few of us, and Christina is sharing her screen. So it's helpful to see who's with us this morning. So if you could just put your name in the chat box, that would be great. And so to kick us off with kind of the information and update portion of our agenda, we have a few speakers lined up this morning. So Superintendent Geisels is going to start by kicking us off with the update on what's happening with Tahoe Truckee Unified School District. Mary Moore with Connecting Point is going to talk a little bit about what's happening with vaccinations. I think Judy Newland, I think I saw Judy on the call. She's going to talk about vaccinations from a Tahoe Forest Hospital's perspective. And then Elizabeth with Sarah Community House is with us this morning to talk about Eviction Moratorium and give us a heads up about what we should all be paying attention to around housing and everything that's happening in that world. So to kick us off, Carmen, I'm going to turn it over to you for a very brief update on what's happening with TUSD.
Allison, I don't believe Carmen is on yet.
I was just kind of going for it. I really couldn't tell if she was here or not. So I was kind of hoping.
Mary, if you're ready, maybe we'll kick it off with Mary.
That sounds great.
Awesome. If I can find my mute button. Thanks, everybody. Allison, Christina, thanks so much for the time. My name is Mary Moore, and I am with Connecting Point. We operate the 2-in-1 service in Nevada County and in Placer County. I'm joined here today by my colleague, Tiffany Lombardi. She is our resource specialist for Placer County. And so just to give, many of you are very intimately familiar with what we do at 2-in-1, but just to provide a little bit of context, we've been in Nevada County for a long time, but we just launched in Placer in July 2020, which of course allows us to serve the Tahoe Truckee area a lot more effectively. We also do coordinated entry for people experiencing homelessness in both counties. And we are the entry point for specific programs, perhaps notably TBRA, or tenant-based rental assistance, which has been available through Placer County. People can call our call center to apply. And just ran the numbers this morning. I think we're up to 165 referrals in Placer County. We are also the entry point for some of the new housing and rental assistance through AMI Housing. So that's really exciting for us, and looking to expand that as programs become available in both counties. Also, we run the COVID-19 helpline in both counties. That was part of our soft launch, and Placer was transferring the county helpline to us, which is what I'm really here to talk about today, because the hot topic has been vaccines, vaccines, vaccines. Our call volume has almost quadrupled over the past 2 weeks. That's an increase of 400% on some days. We've enacted some mutual aid agreements with some of our county partners. Some of you on this call may have even gotten an email saying, hey, can you do a shift? That's to allow us to onboard volunteer call agents temporarily to ensure that we can keep those wait times low and to make sure that our call agents can spend, whatever time is needed with the callers that are calling in. But really the number one topic is about the COVID-19 vaccine, appointment availability, scheduling, questions about scheduling changes, cancellations, and now second doses. We're getting a lot of questions about how to make appointments for those. And the situation is rather complex. I know we'll hear a little bit more about it soon later in this meeting, but effectively the state is dictating who is eligible for vaccines, but those vaccines are distributed at the county level, so their availability is really different. And so there's been just a lot of questions about how to access that for people who are eligible. And, some people are eligible based on age, some are eligible based on their employer. So do I get the vaccine where I live or where I work? A lot of folks are crossing county lines. So we are trying to assist people with the latest and greatest information available from our county partners. We work directly with the public information officers for both counties to make sure that we have the latest and greatest information available for folks. And so I think Christina has posted into the chat box a one-pager that we've created for you as a takeaway with links to our internal reference. We've created kind of an FAQ that continues to grow and change within our internal database system that the public can access through our website. It's exactly the same information that our call agents have. So on that one-page PDF, you'll see those links. And we've attempted to provide some links to state and county resources, official resources that can give you updates about vaccine availability. I think the good news is that both counties are taking a look at a new system that's being piloted in LA and San Diego. It's called My Turn. You can sign up now at myturn.ca.gov. And that everyone is hoping will become a single point of entry for eligibility notification as well as scheduling. So fingers crossed, it's still in a pilot, but hopefully that will come online within the next couple weeks. In the meantime, you can subscribe to our official 211 text alerts. Again, we're coordinating with both counties to ensure that those are going out in a timely manner with official information. For Nevada County, you can text vaccine info to 898-211. And in Placer County, you can text Placer vaccine to 898-211. I'll go ahead and put that in the chat box for you, as many of you will want to sign up for both. Right now we have 9,000 subscriptions in Nevada County, and I think we're rounding the corner on 17,000 subscriptions in Placer County. So we're hoping that this kind of push of information will help people that are just continually monitoring to see when new appointments are becoming available in their area and when the eligibility criteria changes. Again, to soften the blow to the call center and make sure that we're serving all of our customers and consumers as effectively as possible. And the information is constantly changing. So if you're feeling a bit unclear or confused, you're not alone. So feel free to give us a call. We'll call you back for sure. We've also seen a huge spike in our live text interactions. You can text your zip code to 898-211, and that will get you in a live text conversation with one of our call agents. And we've seen those increase to up to 100 a day. I think we were north of 1,100 in Nevada County alone just last week. So people are really starting to consume our service in different ways to try to get these updates. So mindful of time, I'll leave it at that. If anyone has specific questions for me, feel free to put them into the chat box. And Tiffany and I are also both on the CCTT Slack channel, so feel free to find us there as well.
Thank you, Mary. And 211 has been such a tremendous resource for a long time, and specifically over the last several months. So we really appreciate that there's like one central place to call for all these critical services. So thank you very much. So I'd love to welcome Judy to give a quick update from the hospital, and then we'll have just 2 minutes or so to open it up for any vaccination questions. And you can, again, also put your information in the chat box.
Thank you, Allison. And for those who don't know me, I'm Judy Newland, and I'm the Chief Operating Officer at Tahoe Forest Hospital. So glad to give an update on what's occurring. What I like to do is I really like to start kind of a little higher level so that everybody understands it's really the federal government allocates to each state how many doses of vaccines they get. And that's really dependent on population by state. And then what the state does is then they allocate vaccination doses based on population. And so what we have found, probably all of us have noticed during this process, is that the rural counties obviously then don't get as many vaccines. And so I just, and that's challenging. So Nevada County, some weeks will only get 100 in a week of doses, or 200. Placer County gets a little bit more, but again, and they have a bigger population, but we have to remember in Placer County that on the east side, they have to figure out how many doses they can allocate based on east and west population. So it's really challenging for the rural counties in their ability to get vaccines. So I did want to share that with everybody so they are aware how that happens, and the hands are tied at this point. So hopefully, we all keep saying hopefully there'll be more vaccines. So when this pandemic started, Tahoe Forest Hospital reached out to both Nevada and Placer County, recognizing that on the east end, there are not a lot of providers potentially that could provide vaccines. And again, just another step back, the district actually works with 2 states and 3 counties. We work with the state of Nevada, Washoe County, and then in California, Nevada and Placer County. And I want you all to understand that each county manages the process differently. And each county is at a different tier than the others. And so really, for Washoe County, the state of Nevada is further along than Placer and Nevada County, which is painful when you live next to that county. But again, they have a lot more resources in Washoe County, and they're able to bring people in and move people through faster. If you haven't been to their event center, I think they have what they call 15 lanes. They have 15 nurses or 30 nurses, and you just get in 15 lines and off you go. While in Placer and Nevada County, they don't have those resources, and we're all trying to work together to help the community. So the hospital did reach out to Nevada and Placer County and said, what can we do to help? And we agreed that we would help under their direction to provide a clinic in Truckee. Each county, so Placer County, so everybody is aware, actually has 2 providers that provide vaccines. One is the Kings Beach Pharmacy, and the other is Tahoe Forest Hospital. And then in Nevada County, they actually have in Truckee 3 providers that provide vaccines. One is the Safeway Pharmacy, the county clinic, and then Tahoe Forest Hospital. And so what's important to understand in this process is the counties decide who you vaccinate. So just because you are a provider doesn't mean that you can just vaccinate anybody. They actually tell you who to vaccinate. So at Tahoe Forest Hospital, at that clinic at Sierra College, who has been nice enough to let us use, thank you very much, we are only vaccinating 75 and older. That has been from Placer County and Nevada County. That is who we are vaccinating. Now, I know it's confusing because a week and a half ago we were vaccinating 65 and older, but that has been pulled back, and we are now only doing 75 and older. We are also doing phase 1A, completing phase 1A individuals that Nevada County sends to us. So that is how that process works. So we currently have that clinic, and depending on who our allocation, we're able to open a vaccine clinic. So an example is this week we didn't receive any from Placer County. We did receive from Nevada County in order to help vaccinate some of the teachers. What we did do is, and we appreciate with Nevada and Placer County, and it's actually nice to see Mary. I didn't really know her, so now I know the face behind all those people I try to push towards her for the call, so sorry. We did implement for our communities the 211 text alert. So we did send out on our website, we did send out for those 65 and 75 and older on our My Chart, and we did send out via social media that is the way people will get notified for new appointments. And we realized that there's still some work to be done. It's not an easy process, and we don't even know till Friday, by the way, what's available the next week. So next week, we have no idea what vaccines we're getting for next week. So that's why it's so challenging for all the community. But do appreciate that working with both Nevada and Placer County. And just a reminder, sometimes it gets confusing because those two counties actually work differently. They have different tiers that are active. And so the three of us actually try to, communicate routinely in order to try to make that as easy as we can for the population. But I think the biggest challenge for everybody is I know that, people want their vaccines, and it's really challenging in the rural areas. So, the most we can be is patient. I know that's hard. We are working the best we can. I will tell you, we set up this clinic in Sierra College. We were so passionate to give vaccines that we actually set up that we would be able to do 160 to 180 a day. And unfortunately, we've just recently come to the realization that that's not going to happen because we don't have the vaccines to do that. And so we really want to have more consistency. And so we are trying to work with our counties to say, hey, just tell us how many vaccines we can have a week. If we can have 300, if we can have 400, if we only get 200, let us know so the community can feel that there's more consistency in what they're providing. So hopefully we'll get to that number Friday, a little more consistency, and then begin to roll that out. But again, we are vaccinating over 75 and appreciate the opportunity to share how this works. And again, working with Nevada and Placer County together. And Mary, love your call line, and really got to see the voice where we keep really trying to send people to 211 because the hospital is taking a lot of calls. And I know there's people that are upset because they can't get a vaccination, but really it's all based on that allocation. So thank you, Allison, for the opportunity to share the information.
Thank you, Judy. I appreciate you keeping us up to speed. So any quick questions for Judy or for Mary? I've seen quite a few questions specifically for Mary in the chat box around 211. Any questions for Judy that you can either just jump in or you can put in the chat box?
Will those 65 plus who got their first dose be able to get their second?
Yeah, so what we do at what we do at the clinic in Truckee is when you come and get your first dose, you have to wait 15 minutes to make sure you don't get a reaction. And we have somebody there with an iPad, and you make your second dose at that time. We do not want anybody to leave without making their second dose appointment. So we make it 21 days later, and we try to get it around the time of your first dose.
Thank you.
Any other questions for either Judy or for Mary? Okay, so thank you both so much. Mary, we tried to pull up your PDF, but my internet was slow and so is Christina's, but we'll make sure that you all get that on the call, that it's on the Slack channel. And again, we just appreciate you keeping us up to date in this rapidly changing environment with vaccines. So thank you so much. Okay, so our next update is from Tahoe Truckee Unified School District. So Carmen, I see you've joined the call. There you are. So if you wouldn't mind just providing our collaborative partners with a very quick update on what's happening with Tahoe Truckee Unified School District. And thank you for joining us.
Thank you for having me. Sorry, I've been jumping from meeting to meeting today, so I apologize if I was late. We have transitioned back into hybrid instruction. As of yesterday, we're very excited about that. Although Donner Trail Elementary is in distance learning because of the snowstorm that just kind of stayed up there. We're really excited about working with our teachers union. We met with them again in preparation for returning back into hybrid. They are concerned about the variant, the virus variant. So we've supplied them with extra respirator masks is what they're called. And Judy can tell me the technical term. They're the KN95s, the N95s, and the RF95s, I believe. And then also too, we're supplying each of our high schools and middle school classrooms with MERV 13 air purifiers. We're looking to hopefully do the same for our elementaries as the year progresses. It's not only good for this time of this situation, but this fire season too, it would help with that. So we're really thrilled about that. We're continuing with our ride out testing center. I'm happy to report that because we have an employee that drives down the completed tests every day, we've gotten it down as low as 24 hours for a result, which is pretty awesome. I had heard from an employee yesterday who was a direct exposure. She went in yesterday morning at 7:30, and by 8:30 this morning, she got her results, which happily she's negative. But that's the best that we can do. I think we're really excited about that. Otherwise, we would have to rely on FedEx, but we just thought we would kind of continue that for the rest of the year in transporting that. Also, too, eventually, it would be our dream, our hope, our desire to move into 5-day in person. But because of the new California Department of Public Health guidelines that came out January 14th, there's a lot of new requirements that districts must follow in order to do that. So we're going to take it one day at a time and see how things are going. We're excited that the case rates in Placer County, who we report to, have gone down. I think it's 18.5% per 100,000, I think was the case rate right now. So from the 40s just a few weeks ago. So we're just busy moving forward and continuing to do our work. And we're glad we got kids back in school, and we're just going to keep going forward. So.
Thank you, Carmen. I appreciate it. I appreciate you providing a quick update because, again, I know you have a lot going on. So any quick comments or questions for Carmen? And again, you can use the chat box or you can just jump right on in. Okay, I see none, Carmen. So thank you again for joining us. And as a parent of 3 kids at Tahoe Truckee Unified School District, they are thrilled to be back.
Yes.
And in-person learning a couple days a week. It's like really shifted their mood. They're excited to go to school. They were so happy it wasn't a snow day. Like they're pumped.
Yes.
Thank you. They're really stoked.
We're excited as well. So we're happy to be back.
I have a quick question.
Yes.
If you don't mind, is there, do we have like an ETA or like a phase rollout system for when outside organizations are going to be allowed back into the schools to do presentations?
Not anytime soon.
Okay.
We are keeping volunteers out and parents out, and to be able to keep it as safe as possible. It may not happen until next year, in fact, but we want to be able to keep the cohorts as confined as possible. I wish I could tell you more, but that's where we're at right now.
Awesome.
So.
Thank you.
Thanks, Carmen. And then there was one other question in the chat box as far as teachers getting vaccinated and the schedule for that, or the timeline for that.
We're working with both counties and of course with Miss Judy Newland as far as that's concerned, and hope to have some plans that we can address, in the coming future. So yes, we're definitely working with our partner entities, and they've been absolutely amazing with that. So
great. Thanks so much, Carmen. And thank you again for joining us. Thanks for all your work. Okay, so we are going to now shift gears to our final update for the day, which is an update on the eviction moratorium, what's happening around housing. And so Elizabeth Ballman with Sierra Community House, I will turn it over to your very capable hands. And thank you for joining us this morning.
Yes, so we are really excited to announce that the eviction moratorium has been extended as expected. Community members may still be experiencing COVID-related loss of income, and the most recent moratorium that we had expired at the end of the month, and so last week it was extended till the end of June. So that's the California extension, that's AB 91. As well, the feds also extended the federal moratorium, the CDC moratorium. So since this just happened, we'll know more about the nitty-gritty of the implementation, but the broad strokes, the big picture is that there are basically 2 ways that there will be an influx of rental relief. So one is directly for tenants. The essence of the eviction moratorium remains the same, which is that so long as 25% of rent total during the period of the pandemic is paid by the end of the moratorium, any unpaid rent during that period cannot be the basis of an eviction. So 25% is going to come due at the end of June, and there is rental relief through California from federal funding for that 25% at minimum. So regardless of what landlords choose to do, tenants can apply for that 25%. It looks like there will be a priority for households that are 50% of median income, and at most households can be 80% of median income to take advantage of this funding source. There are other rental relief opportunities through other sources, but through this source, it's the 80 and 50. Then very exciting, kind of a brand new, unprecedented type of rental relief that we've never worked with before, will then be on top of that, or additionally to that, or separate from that, if landlords choose to, with the tenant permission, but it's in the landlord's court, they can apply for 80% of any rent arrearages. So it looks like really that 25% will make sense for households where the landlords are not participating, so that at least they're protected from eviction. And then additionally, landlords can get reimbursement for arrearages. So super, super exciting. I will put in the chat box, California provided a really excellent resource called housingiskey.com. It's takes you to California, but it's a .com, and it gives all the latest and greatest updates on all these kinds of things as they come in. Last thing to share is that this 25% requires that if tenant does receive a 15-day termination notice, which is now the new 3-day notices or 15-day notices, tenant just needs to sign that COVID-related loss of income declaration. And that is available on that website and also on Sierra Community House website. And, you know, as always, as questions come up, please reach out to us directly. I will also be hosting a update on this new law with our partners at Legal Services in Northern California for our staff at Sierra Community House. And if anybody wants to get a little more in the weeds on AB 91, just reach out to me and I can add you to that.
Thank you, Elizabeth.
Thanks.
So any comments or questions for Elizabeth? I know that the homelessness prevention funds and the rental assistance is a quickly changing landscape. And so I feel like there's new information like literally on a daily basis. So we really appreciate you staying on top of it. We appreciate 211 staying on top of it, and we housing. So any questions for Elizabeth or any comments?
Yeah, three quick questions. Hi, my name's Peter. Elizabeth, first off, any word on clarifying as to whether immigration status is relevant to getting this support?
I have not heard anything about that yet. So I don't think it should be an issue. From the list of documentation that I've seen, there's nothing that relates to documentation that is on the documentation that would shore up those applications.
Okay. Okay. Yeah. And then the second thing, just to clarify, I understood that in order for the landlord to get 80%, that they have to explicitly agree to forgive the remaining 20%.
Correct. That's
Okay.
correct.
Yeah. So a landlord that wants to get 100% can only have the tenant get 25%, and then the landlord would have to wait until the end of the moratorium and bring a suit to collect the other 75. Okay. All right. Have you had any feedback from landlords as to whether any experience at all or early thoughts from landlords about whether they are definitely willing to accept 80 and forgive 20?
Yeah, we've had at least one landlord who was very willing to do that and very happy that, you know, the past 3 months of arrearages will be shored up at least 80% and has already agreed. So we'll see how it goes. It's brand new, but so far there has been interest in participating.
Okay. And then the third thing is to when the forms are available. Is it true that this can't happen overnight? So it's what, March maybe?
That's right.
Tenants would actually then need help to do it. And I understand that the money actually has been allocated directly to counties with a population under $200,000, and it is a fixed allocation out of the national amount. So it's possible that the money will run out. Is that right? So for anxious tenants, it will be important for them, like everything else during the pandemic, I guess, to really rush as soon as the systems are up to apply. There's going to be pressure to get their applications in, or will they?
I expect that the strategy, recommendations and best practices and strategies for this will emerge in the coming week or so, and we will pass that on to partners.
Okay, great. Thank you so much.
Yeah, thanks, Elizabeth. And again, we can continue to provide updates at our resource sharing meetings. We can use our Slack channels and put other information in our bulletin. So I think, Peter, those are good questions, and we can definitely do our best to get you information in real time. And then also, again, like leaning on 211 and Sierra Community House, who will have that information. So there was another question in the chat box from Kevin. So do we know what this will look like for CEMs living in apartments? Is it going to be the same or a different process? So for community members living in apartments, this
is for all tenants in any situation. Yeah.
Okay. Awesome, Elizabeth. Like it's like literally just coming out. So I really appreciate your interpretation and your ability to provide like such a clear overview of what is a very complicated funding stream and a very complicated process. And I think, Peter, like you kind of referenced it as far as the 25% versus the 80%. And so thank you, Elizabeth, for your diligence in working your way through that and sharing the information with our collaborative. So we are very grateful. Okay, so we are now going to move on. We generally end our resource share meetings with program updates from all of our partners, but just the way the meeting is structured today, we are now going to open it up for resource sharing. So if your organization has any changes in programming or updates that you want to share with the rest of our collaborative, now is your opportunity to do that. Christina will be recording these updates that will be in the minutes. And Caroline, who is also on the call, you can wave Caroline, is with the Community Foundation, and she's our communications manager, and she is helping us also kind of capture this information. So for those of you that might be multitasking, or for collaborative partners who couldn't be here today, you'll be able to access the information in a concise way. So if you have any updates, if you could go ahead and put your name in the chat box or your organization, I can go ahead and call on you. Or if you don't have access to the chat box, you can kind of just jump in. So Brooke, and welcome, Brooke. I see that you have an update. And for those of you that may recall, Brooke was our collaborative coordinator several years ago. So it's nice to see you back at the table, Brooke. And so I will turn it over to you for a brief
Thank you so
update.
much for fitting me in. It's been way too long. So nice to see some of the same names. Allison, you look amazing. Hi, Laura. Hi, Elizabeth. Hi, Phyllis. Hi, Kim. And Peter. So I have now been in a communications PR role for some years, and recently our agency took on Tahoe Transportation District as a client. I'm sure you all are more well-versed in a lot of their struggles than I am, and it's a great organization. Really am enjoying working with Carl and Steve and Andy and everyone else on the board. The reason I'm here today is because we have announced 4 Incline Village Town Hall meetings over the course of the next several weeks, 2 at the end of next week, Thursday evening and Friday afternoon, and the same time frames the following week. I do have flyers that I can post up in here if you'd like to share them. So this is the very early stages of planning a transit hub in Incline Village. There are mixed views on it, a ton of misinformation. I think Moonshine Inc.'s headline was actually incorrect. There's no sale that has already happened. We're still figuring out what a transit center in Incline Village could look like, might look like, where it might go. There is an intent to purchase the Incline Village Elementary School for consideration without a commitment to doing a project there, but we would have to purchase it, and the grant that they're using to purchase it would secure the spot for as a possible option, and then it would give us the ability to sell it if we choose a different location. A lot of misinformation out there. So these town halls are initially just to give the community a little bit of some background and update everyone on why we're here and what we're doing, and then start to receive feedback. So we're just at the beginning listening phases, and I'll update those now.
Thank you, Brooke. I appreciate the information, and welcome back to the collaborative. And we do have a Slack channel, so Christina can help you access that, and you can post the information there as well. Okay, so next up we have Michelle McDonald with Sierra Community House. And Michelle, you're on mute. I'm not quite sure if you, okay,
No,
great.
Can you hear me?
Awesome.
I have a really slow, everything is slow here on my laptop. I just wanted to tell you a little bit about the ESP program. We have a contract with the Tahoe Donner Public Utilities District, and they have a COVID relief program going on, and we process the applications for community members that are interested in that, and they receive a credit of twice the amount of their highest bill within the last 12 months. And it's just a huge help to community members now who are in arrears or can't pay their utility bills because of the financial impact that the COVID pandemic has inflicted upon them. So I wanted to let you all know about that, and you contact Sierra Community House, our main receptionist, who's Pia Shahood, and she refers them to our advocates for processing of those, and it's done very quickly. And the credits appear on the following community members' bill cycle, and everybody's bill cycles are different. So I wanted to let you know about that. And then the second thing is that we are starting up now our parent cafe for English speakers. We have cafes for Spanish speakers and we have them for English speakers. And the English speaking parent cafes for any of the clients you serve who might be interested in that is every Monday from 3 o'clock to 4:30. It'll be going on continuously now because we're delivering it virtually, but it is not really a class with a teacher that tells people what to think. It's a discussion group for parents, and it's particularly valuable right now because there are so many parents with so many issues that are under stress, and they share with one another. So I wanted to let you all know about that. Thank you.
Thank you, Michelle. So next, we'll keep with Sierra Community House. So Kevin Tomlin, you're up, and then Natalie, and then Heather Schwartz.
Thank you. There's a lot of us on here for Sierra Community House. I just wanted to plug, I plugged in the Slack chat. Sam Stein and I are collabing a survey for Close to Home for Truckee, for the Truckee Tahoe area. I can provide the link for the survey in the chat for you guys. We would appreciate it if you guys could distribute that to any and all community members. The more answers we get, the better we can do for going forward with our grant. So I'll plug that into the chat, and then I'll plug it into the Slack chat again before the end of the week as well. Thank you.
Great, thank you so much. So I'm actually going to keep with Sierra Community House, and so Teresa, you have an additional update, and then we'll go to Natalie and then Heather Schwartz.
Thank you. Hi, everybody. I just wanted to add on to what Michelle shared about the Truckee Donner PUD utility assistance and say that we also offer Southwest Gas utility assistance through a partnership with them, as well as rental assistance. And those funds sort of ebb and flow. And so, we welcome applications from community members. They can connect same way Michelle said, through PIA. Thank you.
Thanks, Teresa. Okay, Natalie, you're up.
All right, thanks. So at the Kids Zone Museum, we continue to send out the newsletter, the Kids Zone at Home activities in English. Also the Kids Zone at Home or Kids Zone at Casa activities in Spanish once a month, but you can also access them on our website or sign up to receive them in your inbox, or anybody else that's interested. We have an online store where we are selling items and we deliver locally, or we also offer curbside sales. And in the chat box, I'm gonna add a link to our Truckee Library Community Bilingual Storytime. that I did at the Kids Zone Museum, and also a Spanish activity with sensory bags and a science art experiment. They're all on Facebook, but I'm going to go ahead and add the links to the chat box, so you guys can feel free to share them with your families. And we are also providing Kids Zone at Home and Kids Zone at Casa kits to families in our outreach groups. We've provided over 300 since the pandemic started, I think exactly 333. And then we've provided over 165 books. And the last couple batches I was able to find bilingual with parent education and we're doing, and what else are we? We're doing a bunch of stuff. But that's what I can remember. You can also find more things on Facebook. We're putting activities on there in Spanish and English on our Facebook page. And I'll put all of this in our chat box.
Thanks so much, Natalie. Okay, Heather.
Hi, I'm Heather with SOS Outreach. Just wanted to share that we are still continuing with registration for our second session for our Learn to Ride program for kids in grades 3 through 9, specifically for learning how to ski or snowboard and being introduced to the SOS program and moving on into our mentor program next year. I will go ahead and I can put my email too in the chat box. I have posted our flyers. So if you work with youth who are eligible and would be interested, please feel free to share it. They can contact me, call me, email me. I'm happy to help them get registered. We also do have some teacher coordinators now in schools at Alder Creek Middle School and Kings Beach Elementary and North Tahoe. So I can also share those names with you, but they are in the Slack channel as well.
Thank you, Heather. I appreciate the update. And so in the chat box, Kayla also put some information about recruitment for ARC. Kayla, do you want to add any commentary?
Just that, so we're starting recruitment for our high school summer programs. They're 33-day long courses. There's going to be one here in Tahoe that I'm going to be leading. And so if you know of any high school student that's been struggling and just needs a community of support, needs academic support, could benefit from some activities that support leadership development, needs to get outside, we would love to have them apply for our summer programs. And all the details are in the chat. Our application is now live on our website, and anyone can reach out to me directly if they have someone they want to refer or a student or a parent who just has questions.
Thank you, Kayla. And Kim Bradley noted that she's looking for a therapist. So Kim, I don't know if it's for you or for the school district, if you could elaborate a little
Everyone
bit more.
I know needs a therapist right now. No, the school district is looking to contract with a therapist or an intern to see some of our students in need. We have a couple on board, but we're looking at, because of people's caseload, that they can't work 20 hours, that we're willing to work with less hours. If you know of a therapist that might be interested, contact me. Thanks.
Thank you, Kim. And then Lizzie Hennessy, I noticed a couple of things in the chat box from you. So specifically about vaccinations and an upcoming authentic wellness talk. So any commentary from you?
Sure. Yeah, good. I saw Felicity was able to get the flyer in there. I couldn't tell. So we have there's been a bunch of outreach in English about the COVID vaccine, we feel. So we're doing a Spanish language town hall Q&A in collaboration with Sierra Community House and 3 medical providers of Tahoe Forest Health System. So it is not in English. The flyer is bilingual so that we can help spread the word, but the session itself is predominantly in Spanish with minimal English for just for clarification purposes. So it'll be with Dr. Cole and Dr. Samuelson and Sam Smith, who's a PA, and Anibal with Sierra Community House will be moderating. So that is coming up next Tuesday, I believe. And then we still have our Authentic Wellness series going on. These are free talks in the evening on Zoom. The next one's on sleep with Dr. Turdell. And then later in February is with Linda McKenzie, who is a biofeedback therapist on heart health and breathing.
Awesome. Thank you, Lizzie.
Thank you.
So any other final program updates? I'm just breezing through the chat box to make sure I haven't missed anything. Anyone else want to jump in?
Felicity has her hand up.
Thank you. Felicity.
Yes, I did. Thank you. And I was going to announce pretty much what Lizzie just shared. And also our Sierra Community House promotoras have working very intensely in the COVID outreach and education, and our peer support program has been growing quite strong. So I just wanted to share those updates with you. A lot going on with our program. Thank you.
Thanks, Ellie. Okay, any other updates before we move on?
Really quick, we're starting a new MBSAT cohort. That's mindfulness-based substance abuse treatment. I apologize, I'm not seeing a specific date. I believe it's February 16th. But you can find it on our website, and it's easy to refer, self-refer, or families can self-refer, or counselors or any agency people can refer a youth to that. And we're meeting outside around a campfire. It's been really nice. Not today, but most days. Thanks.
Thank you, Peter. Okay, so thank you everybody for your updates. And again, Christina and Caroline are helping us capture that information. So it will be available to you after this meeting as well. And as always, please access our Slack channel, and Christina sends out a bulletin twice a month as well if you have additional announcements. Yes, Lizzie has one more update.
Okay, so it's always good to end on a great note. And I wanted to share with all the partners here that we recently received notice that we received a $300,000 grant to work on adverse childhood experiences. And so this is a collaboration with the hospital and Placer Nevada County and Gateway and the school district and Sierra Community House. I think that's in the community collaborative, of course. And so I'm just really appreciative that all these organizations have helped to get to where we are now. And we're super excited to spend this money in 6 months. So good job.
Thanks, Lizzie, and strong work. I had heard it was like the fastest RFP in history. So really impressive work cranking out a pretty in-depth application. So good job. Okay, so we are going to shift gears now. So Christina, if you wouldn't mind sharing your screen and bringing it back